Hyperbaric oxygen therapy isn't usually the first thing they think about regarding prostate cancer. In the right context, it can be a powerful tool. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. Hyperbaric oxygen therapy is not a replacement to traditional therapy like chemotherapy or radiation. Hyperbaric oxygen therapy is oxygen that is administered under pressure. So it's in a pressurized capsule. With hyperbaric oxygen, you can actually have, under pressure, put the oxygen in the fluid base of the blood. There's several different reasons why I do. Hyperbaric oxygen is great at boosting the immune system. So we're able to make more white blood cells that are effective on killing the cancer cells. I consider it for patients that have this chronic inflammatory response, which is usually the case in prostate cancer patients, because hyperbaric oxygen would decrease the inflammation throughout the body, including in the prostate. And then it's one of the oxidative therapies that I use, because what happens is you give a lot of oxygen to a cell that doesn't use it, like a cancer cell, it makes reactive oxygen species and kills it. I love to use hyperbaric oxygen because it helps the radiation work better. I like to do it synergistically with it. Or let's say you've already had radiation, it helps heal the tissue and then mop up any remainder cancer cells that might be lingering in there and help kill them that way. I don't use hyperbaric oxygen therapy in someone that has a lot of congestion in their sinuses, even though there are ways that we fix that. We give them Sudafed or whatever things to decrease that congestion, because that can cause a lot of pressure in the sinuses and pressure in the ears, and they really don't enjoy the hyperbaric oxygen therapy. So I limit it in those type of patients. I also don't use this in people that have any type of severe retinal detachment or anything like that, or pneumothorax, which is collapsing of the lungs. You definitely know you have that going on, but I don't use hyperbaric oxygen in those circumstances either. Yeah, so hyperbaric oxygen, what it looks like is you do a 60, 90-minute session. So you go into this capsule, and they're all variable. If you're claustrophobic, you want to make sure you get a little bit bigger one. I have lay down chambers. I have upright chambers. Most of my claustrophobic patients do better in the upright chamber. For some reason, looking up at the ceiling there usually gives them a little bit of claustrophobia and makes them not feel as comfortable, but the sit down, they tend to be really great there. Inside the capsule, we have our medical assistant is always watching and making sure that the patient is comfortable and everything is going okay. People can look at their phone, read a book, etc., take a nap, whatever. Most people really feel relaxed in there, and actually a lot of my patients sleep when they're in the chamber. So if you're receiving conventional therapies like chemotherapy, radiation therapies, etc., you need to discuss this with the integrative oncologist that has an expertise in hyperbaric oxygen to be able to know when to use these therapies to not interfere with those therapies at all and actually have the improvements that you're looking for. I'm Dr. Jake Schmutz, medical doctor and integrative oncologist. If you're interested in setting up an appointment with me, you could click the link below. We're looking forward to hearing from you.